HHS, just to let you know that this is being recorded. The Suicide Prevention Resource Center is the only federally funded resource center devoted to advancing the implementation of the National Strategy of Suicide Prevention. SPRC is supported through the grant from the U.S. Department of Health and Human Services, Substance Abuse and Mental Health Service Administration, SAMHSA. SPRC builds capacity and infrastructure for effective suicide prevention through consultation, training, and resources for state, tribal health, behavioral health, and community systems, professionals, professional education programs, and national public and private partners. Next slide, please. And I'm going to do a land acknowledgement. This was developed by Dr. D. Bigfoot. We acknowledge that the land that now makes up the United States of America was the traditional home, hunting ground, trade exchange point, and migration route of more than 574 American Indian and Alaska Native federally recognized tribes, and many more tribal nations that are not federally recognized or no longer exist. We recognize the cruel legacy of slavery and colonialism in our nation and acknowledge that people whose labor was exploited for generations to help establish the economy of the United States. We honor Indigenous, enslaved, and immigrant peoples' resilience, labor, and stewardship of the land, and commit to creating a future founded on respect, justice, and inclusion for all people as we work to heal the deepest generational wounds. Next slide, please. At first, I would like to have Dr. Pamela Endahorn introduce herself.
Good morning. Hamdakyapi, Nimachapi, Mazashawi, Oglala Lakota, Pine Ridge Indian Reservation, Pine Ridge, South Dakota. Hi, good morning. I am Dr. Pamela Endahorn. I am the National Suicide Prevention Consultant for Indian Health Service. I am located at the Indian Health Service headquarters, which is located in Rockville, Maryland. I currently work remote from Longmont, Colorado, which is just north of Denver, Colorado, about 30 miles east of Boulder, Colorado. So happy to be here. Thank you.
Thank you, Dr. Endahorn. Next, I would like to introduce, I have Rochelle Hamilton introduce herself.
Hi, classisch seinu aksaku SSMT, Rochelle Williams, class lamamutli anti hadas akso. My name is Rochelle Hamilton, and I did tell you that it was Williams, but that's because I keep forgetting my last name has changed. But I am Rochelle Hamilton. I'm an enrolled member of the Ahadasat First Nation. I am also a descendant of the Tulalip tribes, which is where I live and call home in Washington State. I am overseeing Volunteers of America, Western Washington, the Native and Strong Lifeline, as well as the Native Resource Hub. And I'm really excited to be here today. Thank you.
Thank you, Rochelle. And I guess I need to introduce myself. I am Vicki LaFramboise. I am Blackfeet from Blackfeet Nation in Browning, Montana. I am the Director of Tribal Initiatives from SPRC, and I am located in Spokane, Washington, although SPRC is located in Oklahoma City out of Oklahoma University Health Science Center. And there are numerous people working out of different places. And now I would like to have Dr. Jerry Weisner, JD, introduce herself. Thank you, Jerry.
Yes, and thank you. Jawo Jifkados Jerry Weisner, Muskogee, Obanagan, Keithley, and Comus. My name is Jerry Weisner. I am the Attorney General for the Muskogee Creek Nation, and I am a tribal member of this Muskogee Creek Nation. Prior to being appointed Attorney General for my tribe, I served as a tribal prosecutor for approximately 20 years for various tribes across the country, across the state of Oklahoma, but in Texas, in Nebraska, and was a special prosecutor on conflict cases around the country. I have specialized in child maltreatment, domestic violence, but basically any kind of criminal matter in the Indian country, from homicide to traffic tickets, I have handled in my experience. So it's an honor and privilege to be with you today.
Thank you so much. And I appreciate our panelists that are going to answer some questions that we're going to ask them. And we will have an opportunity at the end for some questions and answers. So I also would like to spotlight our technical assistant folks, Angie Mize and Colleen Solitis, and the people on the behind the scenes that are make this happen for us. And so if you have questions, I believe you can put them in the chat, but we will address those at the end. So I will ask some questions to our panelists. And the first one will be directed to Jerry. What is jurisdiction and how do you define that?
Thank you for the question. And I wish that I could say that jurisdiction to answer what is jurisdiction is a simple answer, but it is not. In broad terms, jurisdiction, I'm reading this from the dictionary. Jurisdiction is the official power to make legal decisions and judgments. It can also be seen as the power of a court to adjudicate cases and issue orders. As we look at matters, there are three general bodies that we look to with respect to jurisdiction. There are federal jurisdictions, state jurisdictions, and tribal jurisdictions. There are within those three, and I'm going to speak generally with respect to the United States, because that's my experience and that's what I can speak to. Within those three, the three governments. Within them, there are also, it breaks down into subcategories. So jurisdiction will also depend on, are we talking about criminal jurisdiction or civil jurisdiction? Criminal jurisdiction will also, not only is it broken into the two types of jurisdiction within each of those governments, but what type of criminal jurisdiction? So if we are looking to, and if the issue is Indian country criminal jurisdiction basically has two prongs if you're looking at this from a federal perspective. The first prong is someone, a subject or a potential criminal actor would need to have some ounce or some proof of Indian blood. The second component for there to be criminal federal jurisdiction is that subject would also need to be recognized by that tribal community. So there's a two-part prong for there to be federal criminal jurisdiction in Indian country. Now, let's take a look at the 50 states. If someone commits a crime in the state of Oklahoma, it really doesn't matter where you're from, because they're going to look at it and say, you've committed a crime. It is against the laws of the state of Oklahoma. Therefore, you will be subject to that. Okay, that's an easy look at criminal jurisdiction. But let's take it to that third governmental body, tribal jurisdiction. Now, it gets even more complicated, but I want to make sure that we don't get too far into the weeds. There are PL 280 jurisdictions where the tribe and the state will exercise criminal jurisdiction for the tribe. And there are self-governance 638 tribes where they have their own law enforcement, they have their own tribal criminal code. And within that tribal criminal code, they will spell out what that jurisdiction is. For example, the Muskogee Creek Nation, prior to July 9th of 2020 in the McGirt decision, the Muskogee Creek Nation had historical lands. And within that, they were fractionated. There were allotment parcels, there were trust, restricted, and fee lands. And we had to go through and evaluate everything on what is looked at as a checkerboard jurisdiction. it was really difficult. We always had to update our maps as to who had ownership and control of the land, if it was sold, if it was conveyed in some transaction or life estate, or in some kind of other bequeathing. Then we had to find out who owned and possessed the land to further understand jurisdiction. But in the McGirt decision, the Muskogee Creek Nation had our treaty of 1866 recognized. Excuse me. So we now have a restored reservation. We went from approximately 3,000 acres where we exercise jurisdiction to now over 3 million acres. And that includes the majority of the city of Tulsa. So we had to expand and reevaluate what is our criminal jurisdiction with respect to everything going on. But that's a little quick synopsis of criminal jurisdiction in the federal, in the state, and in the tribal context. Again, to understand an easy, quick, down and dirty to understand criminal jurisdiction is, where are you and what did you do? Or where are you, where was the crime committed, and who committed the crime, who is the victim? Now, that is a criminal view of jurisdiction. Now, if we look at civil, just recognize that civil jurisdiction also exists in the federal, in the state, and in the tribal governments. So it's going to differ in each one of them, and each federal, state, and tribal jurisdiction will be able to dictate and exercise that self-governance and sovereignty to espouse what is the parameters of that jurisdiction. For civil matters, for a tribe, do they only handle Indian Child Welfare Act cases, or do they do guardianships? Now, is the guardianships only for tribal members, or you may have a non-native grandmother getting a guardianship over tribal children? How about divorces? Do they both have to be tribal members? What if somebody's from a different tribe or not a tribal member? That will be found within each tribal jurisdiction. They have that sovereignty and that self-governance to be able to write out and spell out and determine what is their jurisdiction. And the same for the state, and the same for the federal government. So without being too complex, this being an entry-level course in law school, just know that there is civil and there is criminal jurisdiction, both in the federal and the state and in tribal jurisdictions. And to fully understand and determine what that jurisdiction and what those parameters may be, I would advise that you look to that source, to that governmental source and information to find out what exactly are those exercised parameters of jurisdiction. Mado.
Thank you for that, making a complex thing a little bit more understandable in layman's terms. Thank you so much. Dr. Endelhorn, for you, how does jurisdiction differ between county, state, tribal, and federal?
As Dr. Weisner indicated, it really is a local level issue. So when you're dealing with situations within the area that you are located, you have to understand what you're dealing with. If we're talking about mental health, specifically in relation to suicide, mental health issues, that's going to become a civil issue. So we're talking more about what is locally determined for civil. We do have tribes who do not have a code for a mental health hold. This is something that you have to be aware of when we're dealing with tribal communities, especially with mental health issues, crisis. And when you're thinking about it, to what extent does that tribe have any kind of relationship with the county or state in which they're located? Does that tribe have any kind of bifurcation of the tribal community between different states? We do have a number of them. And then also having to look at it from the perspective of what is it that is allowable and not allowable if there's jurisdictional agreements between the tribe and the state. My tribe does have a jurisdictional agreement with certain counties of our state, not all counties. How does that impact when we're thinking about mental health? How does that impact when we're thinking about service provision? And what does that mean ultimately? If an individual is in crisis, then what happens next? So if an individual goes into crisis, they call 988, they initiate a rescue. That's going to have a huge impact on who can respond and to what extent under the law they can respond. And so I'll use my own reservation as an example. I'm from the Pine Ridge Indian Reservation of South Dakota, Moguola Lakota. And if somebody calls, there is that jurisdictional agreement that the county can come onto the reservation now and help assist. What does that mean? It really depends upon how the tribe defined it. But ultimately, they can, to a certain extent, assist my tribe to initiate a health and welfare check and to do a mental health hold, and then to transport them off reservation to obtain services if necessary. It's very limited though. And so when we're thinking about it from the tribal perspective, it really does depend locally on what is it that's going on, how does that impact services available within the state and the county, and then where. We also in South Dakota have services that are available in the state next to South Dakota, which is Nebraska. That's a whole different situation now that we're dealing with, because now we have other jurisdictions we have to think of. And I often tell people, you have to understand, because when you're thinking about the different areas in the US, I always talk about Colorado and Denver, the I-25 corridor that I live in. There's 31 jurisdictions here. So when you're dealing with an individual who may be just down the road, across the way of the interstate, that's Weld County. I'm located in Boulder County. That's a very different jurisdiction in comparison to if something was to happen here, how do you get help there? So we have to think about it locally, and then we have to act in accordance with what's been determined.
So speaking of different jurisdictions, how is jurisdiction different in tribal communities, tribal colonies, and federal trust lands and urban Indian communities? Can you address those?
Yeah, when you're thinking about tribal communities, it really comes down, is this a federal trust land? If it's federal trust land, then we're talking federal. If it's a tribal colony, that really can make a difference of, is it federal land? And is there any jurisdictional agreements between the tribe and the state and the county? What's allowable and not allowable? And then urban Indian communities, they are going to not be subject to federal, they're going to be subject to local. So that might be county or state. And so again, you have to think about the locality. Where are we talking about? To what extent? And then who has to be part of this conversation? Because states differ as well between county and state, and what happens when you call a crisis and who's going to respond. I used to work in Minnesota, and anytime I had a patient who was talking about suicide and then they potentially left, how does that matter? Because you can call the county sheriff. Often they would call the state patrol, and so state patrol would then take over. And then if they past certain county lines, because certain counties were compacted, then it was a different jurisdictional body. So it really becomes convoluted quickly when we're thinking about it at the local area, but you have to understand your locality.
Thank you for that. Rochelle?
Well, hello.
What is it like? Thank you. Hello. What is it like on the ground for crisis center workers in regards to jurisdiction?
So I can only speak about what happens at our line at the Native and Strong Lifeline in Washington State. And I'll tell you that it might seem like our crisis counselors have a lot of experiences with different jurisdictions, but that's not necessarily the case. And let me tell you why. So those of you that are familiar with the Native and Strong Lifeline, it's good to see you again. Those of you who don't know what it is, in Washington State, we have Tribal 988, known as the Native and Strong Lifeline. It is just like the non-tribal 988 in almost every aspect, aside from we have a little bit of additional training, and then we are also staffed by all Native people. So for us, it should be known that less than 2% of our calls result in any kind of dispatch. Even less so for the Native and Strong Lifeline. I don't know why yet, but we know that this is a good thing. People are getting the services that they need. But at our center, when we have to send somebody to keep somebody else safe, any kind of dispatch or welfare checks, we have regional crisis lines within Volunteers of America, Western Washington. So they're all fostered here with the Native and Strong Lifeline for non-tribal 988, for tribal 988. And so, for example, if a Native and Strong Lifeline counselor feels that somebody needs intervention support, they will then send that referral and talk to that regional crisis line, who, again, we're all here working together. So they'll give them that information so that they can dispatch the appropriate responders to the area. So the regional crisis lines and the people there, they are very familiar with our first responders in their regions of Washington State. It's a little bit, it's not perfect here by any means, but it's a little bit less tricky than some places. And we are fortunate for that. But we know that the relationships with our regional crisis lines, our crisis counselors, and our responders is very strong. And so that's a reason that our crisis counselors, they don't have to get too much into the weeds for jurisdiction, because they know the regional crisis lines are having those relationships with the first responders. So that's what I can speak to for us here. And so I do have some other exciting things that I think we'll talk about a little bit further into the conversation regarding why jurisdiction will apply to us more and why it'll be more important, and relevant to this conversation.
Is that with the DCRs, the designated crisis responders?
Yes. I'm excited to talk about it. So it is very new, if that's okay.
Yeah, please do.
So, and I know there's some people on this call, which I'm really excited about, that actually are working on this. And I think this is really incredible. So what we have in Washington State is, like I said, we have our Native and Strong Lifeline, but we also have another program, which is called the Native Resource Hub. Essentially, this is the mental health 211 for Native people in Washington State, whether their tribal home is here or elsewhere. Anyone in Washington State can call for this service. So we have our Native Resource Hub. And again, we are able to utilize this when we do follow-up calls for the Native and Strong Lifeline, or if people need follow-up resources. But what is very exciting and very cool is that Washington State is working with tribes to make sure that tribes can have designated crisis responders of their own. And so tribes, and it's not for me to explain which tribes and when and who, but tribes in Washington State are working toward this goal of having designated crisis responders. And I believe that we should see some movement on this potentially by the end of the year. And what we're going to do with the Native Resource Hub is, when a tribal designated crisis responder reaches out, they will have the support from us at the Native Resource Hub to know the protocols for the different tribes when they're entering their territories and lands. So a designated crisis responder, tribal or non-tribal, could always call the Native Resource Hub to know before they go, right? Isn't that what it's called? Know before you go. So they will know before they go, when they go into tribal lands, how to do that appropriately, what the protocols are for those tribes. So that's some work that's being done in Washington State. And we're very excited because having crisis responders of our own within the tribes is going to make things so much more seamless. And I know the tribes here are working on those tribal codes, but the Native Resource Hub and the Native and Strong Lifeline are just really pleased to be a part of this from the beginning. And we know that this is going to make things more streamlined, less confusing. I'm listening to like what, Dr. Endahorn and Dr. Weisner were talking about. And I think about Indian child welfare and those things. And these are stickier issues. Our jurisdiction, I have been turned away with tribal court orders a million times. I can't even tell you, just speak out of disrespect for those different jurisdictions. But again, we're fortunate just with Native and Strong to have these regional crisis lines and people that are familiar with the first responders.
Thank you so much.
I will mumble all day, Vicki. I love it. I'm very excited about this work.
It is, and it's complicated, but I love how you three have brought it down to terms that we can all understand and made it, simple. It is very complicated, and it is know before you go, right? Or make that decision or what, and it is very complicated. And I love how you all have made it very simple for us. And we have a little bit of time to expand this, and then We know that there's been some decisions made in the last couple of years, specifically in Oklahoma. So, Jerry, can you tell us what does the jurisdictional landscape look like after the decisions that were made in Oklahoma? What does that look like now?
Well, thank you for that question. And I'm really excited about this, but it's also a little bit daunting at the same time. Careful what you wish for. As I mentioned earlier, we went from 3,000 acres to now having jurisdiction over 3 million acres. And it's not just, rural Oklahoma Indian country. We've got Tulsa and Muskogee and Sapulpa and some pretty good sized towns where it's not just Indians. I mean, that would make it a whole lot easier, but we've got Native Americans, we've got non-Indians, we have people on temporary status in the United States, we have trafficking concerns, trafficking in both kind of ways, trafficking of drugs, trafficking of humans, and driving and code issues. So with respect to the code, it went from having, like many tribes, we have a pretty simplistic code that was handed down to us by the Bureau of Indian Affairs from like the late 1970s that everyone developed, to now needing a robust criminal code to address all the aspects of trafficking, to include the traffic code, to now having code violations if people don't mow their yard, if someone has a barking dog or noise infraction, all the way through to our homicide cases. And then that goes again along with everyone else in Indian country, having to work with our federal partners very closely so that we can run parallel prosecutions, so that our federal partners will take the case, and as well as the tribe, and we run parallel prosecutions to be able to get justice in Indian country, but also working with our state partners. And from that, we have had other Supreme Court cases, Castro v. Huerta, which, no, it's Castro Huerta. Castro Huerta was an unfortunate case that we're still working with, which the decision seemed to be absent of a lot of the case law and the historic precedent that goes into the understanding with Indian country. But we're working with that, as well as we have a 10th Circuit decision, the Muskogee Creek Nation, in the case of Hooper versus the city of Tulsa, where we are now arguing over who has authority to issue traffic citations. And to be honest, and as I look at it, not my understanding, it becomes, in our word, it's Totnawa. At the end of the day, it's about the money. But, we feel strongly that we do have that jurisdiction to be able to exercise not only traffic, but we're already doing, significant and violent crimes, to include all kinds of abuse and homicide, all the way down to traffic, bogus checks, etc. So we have, I like to think that right now, and others might have their opinion on this, I think personally, as I look at everything that's going on around us, we're in an Indian Renaissance, a Native American Renaissance. Right now in Indian country, with respect to the legal perspective, I don't know if there's ever been a time when we've had so many cases having historic and significant impacts on Indian country as we do now. We had Brackeen, the Indian child welfare case that was decided in favor of tribes just this past year. I think there are others going up. We win some, we re-strategize. I don't want to say we lose some, but we re-strategize on others. But it is a robust time for the legal lens in Indian country, not only that, you look at the arts, what's happening with not only the art, but we've got music that is, you can hear it a lot more. We've had TV, our res dogs, that is Muskogee. We're so glad, and it makes me so excited. Somebody can say Chokaji on TV, and I know what they're meaning. And The Killers of the Flower Moon just came out, and not that it's a feel good, but it's something that the world needs to know. And there are more in the pipeline coming across, as well as our clothing. Women are wearing ribbon dresses, ribbon skirts, our tribal and traditional patterns, and it is just a great time to be Indian. And I think with if you just take a look at everything around, and our kids are holding their heads up and pulling their shoulders back and say, yeah, that's me, this is mine, and getting a renewed sense of identity as Indian country and as Native people, it's a good time. I didn't say it was easy in any way, but I think that along with it, what I'm really excited, and I think Dr. Endifhorn mentioned, is making sure that not only do we have these things, but a lot of it comes from our historic trauma, the traumas that we have experienced, the traumas our families and our people have experienced, and being able to bring about all of this awareness to make it into something good, to make it into resources and programs that can help our people who are in crisis, in mental health crisis. And I'll tell you, as a prosecutor, I have too many times been holding the hand of someone in crisis. That is not, I will give 24, if not 5 hours of my day to help someone, but I don't know what to do. But I love having the fact that Rochelle, the Pamela, Vicky, anyone, all of these various peoples now have information and programs at their fingertips that we can reach out to and say, hey, I've got a kid in crisis, I've got an adult in crisis, can you help me? And they say yes. That's what I'm really excited about, all the attention that we're getting in Indian country. Let's turn it into something good, especially in those many ways that we need to be healing and helping ourselves. There's a whole big long answer, but thank you.
Thank you for that. And we have we have the Dr. Endifhorns, the Rochelle Hamiltons, the Sandy Joys, the Jonna James, Angie Mize, Scott Bartons, yes, all those people out there doing this crisis work and just being great resources and all that. My hands are up to all you out there doing this great work out there and all that. So just a follow-up question for this, because of this decisions made out there, and this is directed to Dr. Endifhorn. Pam, how does this decision affect the rest of Indian country?
I think it's really something to, as Dr. Weisner has been indicating, it's something to really think about. That as we're going forward, what is occurring right now in Indian country, especially in the field of crisis services in 988, and what is it that really is impacting, looking at how our Native people need help. What can we do in a new way, a way that we haven't done before, maybe have done before, but really need to retry and to retool and do it again to ensure that our people are receiving the care that they need. And then most importantly, to recognize, and this is the hardest part, is to recognize where those connections need to occur. Because historically, based on historical trauma, based upon everything that Natives have gone through within the United States, it's very difficult to overcome a lot of the trauma that has happened when children have been removed, when they've been forcibly removed and relocated to another area, when we're dealing with a lot of substance abuse and alcoholism, and we're dealing with a lot of disparities when it comes to mental health and to even chronic medical conditions, that when we're thinking about, as we're moving forward in time, recognizing the impact of that, but at the same time, acknowledging it and then addressing it. Because all of that has to play into this as we're talking, is what is it that has happened? How can we address it? What can we do to recognize it, acknowledge it? And then what do we need to put into place as we go forward? Because ultimately helping our people is the basic premise that we need to focus on is how do we help each other? How do we help our people? And how do we address all of these disparities in a way that's going to result in healthy, well-rounded communities and families, and basing that back in the culture, because that is what ultimately what makes us Native.
Thank you for that. Rochelle, would you like to add anything? You know, how does this affect crisis centers, the work that you do, the work that you lead, your center, and anything you want to add?
Well, I just want to add to kind of what everyone's talking about, but really what Dr. Weisner was saying earlier, just is it's so inspiring, and it is such a good time to be Indigenous. And again, it's not been easy. Absolutely not for any of us, but has it been a bit easier than it has in the past? For sure. Like there are some things that are a little bit easier. And, you know, really like we're here today talking about all of these incredible things and we're sorting it out. And look who's doing the sorting. All these Indigenous people that you see, all these people that we know, this is who's doing the sorting. And that's why it's working. We are Indigenous people. We know what we have to do. Just let us do it. Right. And so that really is, you know, I'm just proud to be here, and thank you for having me. There's so much going on in Washington State, and you know, I'm sure that I'll see many of you in this presentation and outside of it, and we'll be talking more about this work, but thank you for having me. And I'm just really inspired to be here with all of you, Dr. Endifor and Dr. Weisner, Vicki, everybody in this call. So thank you.
Yes, thank you. I appreciate the panelists, what they've brought to the table, what they continue to bring to the table, and you know, all the work that you do. I'm going to open it up to questions. If there's any questions from the audience and all that, anybody? Angie, do you see any questions out there?
Do not see any.
You know, we're building this airplane as we're taking off. So no question is a dumb question or a wrong question. And, you know, I'm the type that's like, oh, later on, I'm like, oh, I had that question. What recommendations would you make to contact centers in regards to initial contact with area tribal communities? Anyone want to take that?
I will. I'll take a first stab at it because I think, you know, there may be some other opinions to it. I think that just making a phone call and just starting to build that communication bridge. Introduce yourself. It never hurts to have a humble and inquisitive approach. Maybe you need information, explain what you're doing. And again, be humble. I think so many people are guarded or nervous about contacting Indian country that they're reluctant to. But I think that, you know, from the inside out, we have so many resources that are either specific to our tribal members or to our Native communities or to anyone. So there are various resources that each tribe may have depending on the program. But I think it's always great to build a bridge. And in order to build a bridge, you have to have two separate sides and you have to build from each side to then meet in the middle. So I would just suggest calling up. And the same is true for Indian country on the inside. There are a lot of our partners on the outside that I think that it would behoove us to initiate that contact and reach out to them. I know in many cases there can be historic conflict or animosity. But, you know, I often have to remind myself to overlook that because I serve over 100,000 tribal members, and my commitment and my duty is to them. And in order to do so, it readily steps on top of my own pride. But it's not about that. If I can build that bridge to help our tribal members, then I'm just a mechanism to make things happen. So by all means, grab the phone, call people, invite them to lunch, take something to them, and start a dialogue.
Thank you for that.
But looking at it from a crisis call center perspective, I get a lot of calls from crisis call centers wanting to make contact with local tribes within their state. And that becomes one of the biggest pieces that they run into is, who do I contact? Who would be the best people to make contact with? Often they focus on tribal leaders, which makes sense. They are the ones that are responsible. The problem is that they're quite busy most of the time. And so it makes it very difficult to make contact with a tribal leader. And so often what I do is I make sure that they have connections to tribal health or to other individuals who have some kind of interest or has been working in this area to help get connection made. Unfortunately, there's a lot of tribes. There's 574 tribes. I don't know them all. And so nor can I try. But what we can do then is making the network of who do I know that can help make that connection and get them connected someplace. The difficulty, though, is often how quickly our contacts change within a tribal community. And when we're thinking about it from the perspective that a lot of those connections are informal. And so it really comes down to being aware of the culture. If you are interested in making contact with your crisis call center, all states have at least one. Some states have more than one. Send an email, call them, recognize that they're dealing with crisis, so they're not going to be responsive like just to a general inquiry right away, but start working to make those connections. And if you've tried and you've tried and you've tried and there's nothing more you can do, feel free to shoot me an email and I can help you make those connections through Vibrant, who oversees the network. But really the best way is on the ground at the local level. I'm trying to make those connections because ultimately that's going to breed a lot better connection, understanding, and resources. The other piece I would say is invite them in. Can you come to a health center or a health fair that we're going to have? Come to a powwow. Have them come down. Most of the time they're willing to come. Most of the time they have no idea where they're going. And so they're going to need guidance to get there, which is great because it gives them the opportunity to learn about the community and learn about a community village site that they probably have never looked at or been through. And so it gives them something to really build their repertoire and to start thinking about it from a bigger perspective other than just the area in which they focus on it. It makes them look at other communities, and it might even motivate them to think about beyond American Indian Alaska Natives to communities of faith, other communities of culture. So it could breed a really good just new way of thinking within your local area.
Thank you. Rochelle, you had your hand up.
Well, I feel like they've said it all, but I do just want to back this up though, because one of the things that we talk about often is people always say, and it's usually this question, right? Which is a very valid question. Like, how do we become more involved, or how do we make contact with tribes and communities? And again, with tribal leaders, they're so busy. And it's so difficult for them to be able to, to interact with people that way. But what does work, and what we've seen a million times, is go to the community events, keep showing up and bring something. Don't ask for something first, right? We're not asking for things when we go into other communities. We are bringing something, right? And so I know that this happens. I mean, I've done this. Like, there's that Tim guy. He keeps coming to the basketball jamborees. He's always down at the thing. And I see him over and over, and no one's talking to him. But eventually they do because he keeps turning up. And one day there's something they remember about Mr. Tim that he has to offer that we can maybe use. And then people will start talking. And that's how it works in my area quite often, is we know people like that. We just keep seeing them. And eventually, like, oh, that one guy, he has something. And now I'm going to tell my friends that that one guy that keeps showing up at the basketball tournaments has something for them too. And I know that because I used it and I trust it. And so that is often how things work. And especially when people say, how do we hire from these communities? Same situation. Make something relevant to those communities, bring it to those communities and leave it with them. And if they find that it's good, who knows, right? But that's how I got here. That's how other people know about our services. And so I know that it's something that works really well. Keep showing up. and don't ask for things, right? Offer things.
Thank you so much. Any other questions out there? Okay, can you put up the slides? So this was the last of the collaborating with tribal communities for this first set of our webinar series. Next slide. We have a YouTube channel, so if you missed any of the other presentations or webinars, you can go out and get those. We are going to continue this series in 2024. The titles and dates are coming soon. So just continue looking out there. So coming in early November, there was a 988 formative research, and the findings are going to be released in early November. So just a little insight out there. There was some findings, was insight on about the attitudes, beliefs, perception, barriers, and motivations related to help-seeking behaviors about 988. It included some populations about American Indians, Alaska Native youth, aged between 13 and 34. Also, Asian American, Native Hawaiian, Pacific Islanders, Black youth, Hispanic youth, and young about the same age. So this is just be watching things about this, but coming out on this, that we just wanted to be let you be aware that this was out there. Yeah, so next slide. We already did the questions. Thank you so much to Dr. Endahorn, Rochelle, and Dr. Weisner for being our panelists. And if you are not subscribed to our weekly Spark, the QR code is there, and please subscribe to that. And again, I want to thank our panelists for doing this. We call upon Dr. Endahorn and Rochelle quite often. And again, thank you, Jerry Weisner, for being our first-time panelist for this and for your knowledge on all this. I really put my hands up to all three of you for being a part of the panelists, and for the attendees for being here. Thank you so much. And this will end our this webinar. And again, thank you. And if you've missed any of these, please go out to our YouTube channel and watch the other ones. Thank you so much. And I look forward to next year for you attending our webinars next year. Thank you so much.